one of the things that I did deliberately, because this has been a fear of people making this transition to be able to both either purely coach or coach as a clinician, and both are great paths. Either one works well. I really still, in my private practice, coach as a clinician. So I can get to bring in all of my hats, which is actually wonderful. And either of those things can work and do work well with long-term business support. And that's what we offer here, because at the end of the day, and also because there are increasingly jobs in coaching, more and more and more, which is why we have committed to the rather complex and difficult, time-consuming process to make the Women's Health Coach certification NBC-HWC certified, because we want our graduates to have the opportunity to get those jobs, those more defined, for some people, safer feeling jobs. And we can currently offer them space over time, both in our program and when they graduate. There's lots of opportunity. I'm on live calls 3 times a week to help our clients and our students and graduates develop the exact kind of practice that they want. And one of the things that's really important about how we do that is there's not like a 6-step process to 100K or, whatever you see from business coaching, because everyone's vision, we do everything in the coaching model, and each clinician and coach's vision is different. And this way we have the opportunity and we have the experience. I've been doing this since 2006 and officially since 2009. We have the experience to have seen hundreds of successful, totally unique kinds of businesses. And I think that gives us the insight to help people figure out what the exact right kind of business or practice or job or career fits them. And I think that really helps to ease that fear of, how can I make this work? Well, we've seen it hundreds, if not thousands of times at this point.
Yeah. And I think it's important, like you said, to fit, that's so coaching, right? To fit them. So really to fit their life, to fit their bandwidth, to fit what lights them up, how they want their business to look like, or potentially how to incorporate all of these skills into a clinician role or a different health coaching role. We've seen so many students be able to take these skills and incorporate it in so many different avenues. We've had them incorporated into programs at the VA. We have two students right now, actually, and a master coach who is utilizing these coaching skills to help the VA to create kind of a whole system, a whole body approach to women's health at those centers. We've seen social workers incorporate those skills into their current practice, or to start a whole new, practice where they're using these skills on their own. Students get jobs employed as health coaches through doctors' offices, or for example, for me, even having that credential before I started this role actually opened up so many doors for me as a nurse practitioner. There's more and more doctor's office, hospitals looking for people who are certified coaches, health coaches, to join their team. And I think it's also really important to mention not just on the live coaching calls, like all your years of training and skills of running a successful practice, starting practices, helping students grow their practices, but they also get this on a one-on-one basis as well, in particularly the program with their master coaches. They have the ability to discuss their vision, their dreams, what they're looking for, bring it to the live calls, and can discuss with their coach on their one-on-one calls what that looks like, how to bring it together, what the next best steps are, which you don't see in, I don't know, in any other programs.
No, and we have the retreats also where you'll get to meet more than just your master coach. You get to meet multiple master coaches, and all of our master coaches are working as practicing coaches, and some are hybrid practicing coaches, clinicians. And I think what you said about, there are tons of open roles in healthcare right now, right? But this will set you apart if having a career, a long-term non kind of, exhausting career in healthcare, a non-burnout career in healthcare. When you come to this program, even if you didn't change your job, like you literally went right back to the same job in a hospital system, in a conventional hospital system, or in a conventional medical office, you will now approach each and every patient differently. And the number one thing that our students say to me about that is they go home not exhausted. They go home with energy. They can then live more of their own lives without needing like a day to recover from their shift, to give some more of their energy to their families, to their friends, to themselves. And I think one of the most important commodities, that we have now is our own energy, and deciding, as you were saying before, what our vision is for that energy. So the opportunities have just expanded since we started this training program so long ago, because coaching is more and more and more a desired skill set within healthcare. And I think that's the most important thing. People think, before they really understand what coaching is, that anyone can just be a coach. And while anyone can call themselves a coach, very few people, and so it will differentiate yourself in the marketplace, actually do have a practiced skill set of coaching and the NBC-HWC credential, which really will separate you from the pack.
Yeah, I think it's important. I love how you said about, even if you take this back to clinician, like as a clinician, you take this back, your energy, and to be, everything that you said there was number one on point, and just so beautiful, because I think it's really important to take like that. You take the coaching skills, and it's coming up personally for me. It's just that once I learned these skills, it was the first time in my entire clinician life that I was able to stand up for myself, like actually to take my energy back, to take my power back, and to feel comfortable to say no, because staying late at work or just really didn't align with my values, with my vision, really what was important to me in life. And I was never able to pull that all together until I learned how to be a coach. And not to fault clinician, not at all to fault training or clinicians or any of that, but I also think they just don't teach us how to collaborate with our clients. So once you finally can let that pressure of being responsible for, the plan and the treatments and the, like every single step of their healing journey, and really working on helping that client to decide what is best for them, is just so freeing in so many ways.